So when we find something suspicious on the diagnostic nasal endoscopy, this is what we do. As I told you, we do an nasal endoscopy, and if we find some secretions or crust as shown in the previous slides, we proceed for a we take the secretions for a fungal examination, and this is how we do it. We take the nasal swab or nasal secretions. This patient lies this way on a propped up position. This is my colleague, Dr. Sanjay, doing that. This he's collecting the sample in a different bottle. We make sure that we place an endoscope first, and under its guidance, we go ahead. And the nasal secretions, whichever are collected this way, are labeled and they are sent for fungal examination. And these are examined by the microbiologist. So, what does a microbiologist do? He examines this, and he cannot examine this directly. He stains that with KOH, which is typically done for all the fungal staining. And on the KOH stain, this is how it appears. This is given, this is one of our patients, and this is given by Dr. Ashok, he's a microbiologist. And if the mucor is present, it appears in the form of a broad aseptate hyphae. And once again, remember that this test is highly observer dependent, and we cannot completely rely on this fungal staining. So, in the meantime, after we send the specimen for fungal staining, we also ask the patient, without any waste of time, to undergo an MRI and MRI brain and PNS with the orbit, which is done with a gadolinium contrast. We prefer getting a contrast MRI done, and also CT PNS, CT scan of paranasal sinuses. This is mainly done in order to know the extent of the disease and the type of the disease, because in MRI we can clearly differentiate it from a fungal or a bacterial sinusitis. So once again, before I show you how a diseased CT scan looks like, because this is a shadowing session, let me show you how a normal CT scan appears to be. So these are the CT scan images of a normal person. And remember, the air, whichever you are able to see here, appears jet black in color. The bone, which is seen, appears white, chalk piece white color, and the pus, inflammation, or any kind of tissue appears gray in color. So you can see a pair of frontal sinuses which are located above the eyes, which are entirely black in color, indicating they are good. And a pair of maxillary sinus, this pyramidal shaped sinuses, which are present beneath the eyes, and a pair of ethmoidal sinuses, which are present in between the eyes, and a pair of sphenoid sinuses, which are present behind the eyes and beneath the brain. These are a pair of sphenoid sinuses. Here you can see all the sinuses are completely jet black, and they are filled with air, and hence they are very well ventilated, and they are absolutely normal. So this is the case scenario 1. Once again, I placed a normal CT scan picture above for the comparison. Here you could see that the right maxillary sinus and the ethmoidal sinus and the middle turbinate are completely opacified, and we call this appearance as right maxillary and ethmoidal sinusitis. But we cannot understand whether this opacification is due to simple bacterial sinusitis or fungal sinusitis. We could just say that there is some kind of opacification which is going on, and there is something wrong with the right side maxillary and ethmoidal sinuses, because there is some sort of opacification, and the left side one appears absolutely normal. The same thing holds good on the posterior cuts also. So we proceed with the contrast enhanced MRI. Here we can see the hypodense, the arrow which I have pointed. There are hypointense areas, these ones, and there is no uptake of contrast enhancement here, which is surrounded by a zone of hyperintensity. This zone of hypointense areas where there is no uptake of gadolinium contrast indicates some fungal elements, and the surrounding zone of hyperintense areas indicates they are completely surrounded by inflammation. So it's a clear cut case of fungal sinusitis. Well, you can compare it with the other side. This is of the same patient. So this is the CT scan image of the same person, and this is how the MRI delineates it, that to contrast enhanced MRI. And this is the second case scenario. I placed a normal CT scans once again for your comparison. Here you can see that the entire left maxillary sinus is completely opacified, and you can see some amount of calcifications in between, and this calcification is very typically seen in case of fungal sinusitis, but we are not very sure about it. So we proceeded for an MRI, and this is how it looked on a contrast based MRI basically. So we can see that there is a clear zone of hypointensity, that's the arrow mark which I pointed here, zone of hypointensity, which is surrounded by a zone of hyperintensity. Once again, this zone of hypointensity is caused by the fungal elements because there is no uptake of contrast there, and the zone of hyperintensity is caused by normal inflammation surrounding it. So once again, you can compare it with the other side. This is a CT scan image of the same patient. And similarly, these are the posterior cuts of the MRI. You can see that there are hypointense areas on the other side, maxillary sinus in an MRI. So they are clear-cut fungal elements. This is the CT scan picture of the same patient where you could just see some opacification. That's why we surgeons prefer getting a contrast enhanced MRI. But of course, we need a CT scan because the bony window, bony delineation is very much better with the CT scan. So basically, we need two, both the CT scan and an MRI. And on MRI, we require more of T2 weighted MRI and a contrast based MRI. So, well, right now we know we have everything with us. We understood that the patient is suffering with mucor, and how do we proceed right now?